Does 3D mammography lower unnecessary breast cancer recall rates? Imagine a tool that helps doctors see more clearly inside the breast, reducing the number of women called back for extra tests. That's what 3D mammography, or digital breast tomosynthesis, aims to do. It takes multiple detailed images of the breast from different angles, creating a layered view that helps distinguish real problems from harmless tissue overlaps. This technology is especially useful for women with dense breasts, where overlapping tissue can hide cancers or cause false alarms on traditional two-dimensional mammograms. Research shows that 3D mammography generally lowers the number of women who are asked to return for additional imaging compared to standard two-dimensional scans. Large studies, including those from the Breast Cancer Surveillance Consortium, have found about a 15% reduction in recalls when using 3D imaging. This means fewer women experience the stress and inconvenience of unnecessary follow-up tests. Importantly, this reduction does not mean fewer cancers are found. In fact, studies suggest that cancer detection rates are often slightly higher with 3D mammography, helping catch cancers earlier while reducing false alarms. The biggest benefits in lowering recall rates seem to be in areas where two-dimensional mammography already has higher recall rates, such as in the United States. In places where recall rates are already low, the additional benefit of 3D is smaller but still positive. The reduction in recalls applies to women with both dense and non-dense breasts, though women without dense tissue might see slightly more benefit. It's worth noting that not all radiologists see the same decrease in recalls with 3D mammography. Some variation exists, which highlights the importance of ongoing training and quality checks to get the best results. Factors like a woman's age, breast density, and how often she gets screened can also influence recall rates more than the imaging technology itself. In practical terms, for every 1,000 women screened, using 3D mammography could mean about 16 fewer women being called back unnecessarily. At the same time, it might detect 1 or 2 more cancers, making screening more efficient and less stressful for women. However, 3D mammography isn't perfect. It doesn't eliminate all false positives, and some women will still be recalled for additional tests. It also requires specialized equipment and trained staff, which might not be available everywhere. Ultimately, choosing the right screening method depends on individual risk factors and personal circumstances. Women should talk with their healthcare providers to decide what's best for them. In summary, 3D mammography tends to lower unnecessary recalls while maintaining or even improving cancer detection. This makes it a valuable tool in early breast cancer detection, helping women avoid unnecessary worry and procedures without missing important diagnoses. As always, personalized medical advice from a healthcare professional is key to making the best screening choices.